Hi, my name is Kylie Christensen. I am going to be doing the skill of inserting and discontinuing an IV. Disclaimer before I get started, I have practiced it way too many times and I'm down to my last 22 gauge needle. So I'm going to kind of make a do with what I have. So when I insert it, I'm actually going to remove this in case I need to retry it before submitting it. And I have saved an old catheter. This would never happen in the real world. And I'm going to just hold this here for sake of practicing and getting the skill down because I tried to reset it and I literally couldn't do it. So that's just my disclaimer. Everything has been opened. I've been practicing a bunch. It's kind of tricky, so I'm going to do my best. I have all my supplies, my tubing, my saline, my IV start kit. That's been opened and closed a bunch, and 2 pairs of gloves. So I'm going to go ahead and begin my skill. I'm going to wash my hands, perform hand hygiene, and I'm going to get my gloves on. Alrighty, I am going to begin by getting the tubing. That's open. I'm going to go ahead and begin by flushing the tubing. So I'm going to get the tubing out. I'm going to open my sterile saline. This is going to be my sharps container and my trash. My saline's open. I'm going to go ahead and flush this. Make sure there's no air bubbles in it. Perfect. Put that there. Good, no air bubbles. I'm going to set that down. Next thing I'm going to do is I'm going to go ahead and get the site prepped for insertion. So I'm going to go ahead and place the tourniquet. Get this open as much as possible. Take the tourniquet, place it around. I want it to be 4 to 6 inches above the site where I'm going to be doing the catheter. Make sure it's not too tight. I want to check for a pulse down at the distal to where I'm going to be doing the skill. Okay, so the needle size I selected is a 22 gauge needle. Let me go ahead and just show you the package. 22 gauge 1-inch needle for my patient. It's an appropriate selection. He's 75 years old. We're not going to be doing any surgery or trauma as anticipated. So the 22 gauge needle is appropriate. So once I have the tourniquet on, I'm going to go ahead and clean the site. So with an alcohol swab, I'm going to start from the inside and work my way out. I'm going to let that dry. Then I'm going to go ahead and get my needle ready to insert. So I will remove the cap, place it in here. So I'm going to pull the skin taut like so. I'm going to insert the needle, make sure that it is bevel side up. I'm going to push it in. And then once the needle's in, I would then lower the angle of the needle and then insert about 1/4 inch more. Once I do that, I would press this. I would put my finger over where the IV went in, dispose of this in the sharps container. So my IV is in right here. I'm going to go ahead and keep the IV stable. I'm going to release my tourniquet. Once I do that, I'm then going to connect the saline and flush the saline. So connect, I will aspirate for blood and then I'll flush. Once I have done that, I'm going to go ahead and clamp the tubing. Good. Dispose of this. I'm going to go ahead and this will be a sterile cap. I'm going to go ahead and clamp this off. I'm going to keep this up here. Then what I'm going to do is go ahead and I'm going to take my bandage here and I'm going to put this over the IV site. Same thing, I don't want to take this off. This is my last one and they are a pain to take on and off. But I would remove this white backing and I would place this over the IV so that you could see the IV, you could see the insertion, you could make sure that it was not being affected or irritated. So once I have this on, this is going to go ahead and be secured there. I don't need to necessarily hold it, but it's gonna move. Okay, we're just gonna do that. Once I have that there, I then would take a piece of my tape. Should have done this before. And I'm going to loop this part around above it. Make sure it's not going to get on my bandage. And tape that down. Okay, once I have taped that down, I would label the site, make sure that my initials, KC, the date, the size of the needle, and the length of the catheter are on this. So I would then gather my supplies. This would already have been removed. I would dispose of everything that I don't need. Remove my gloves. Perform hand hygiene and exit the room or leave. When it's time to remove it, I'm going to verify that the order is in for it to be removed. I will enter the room, perform hand hygiene, get a clean pair of gloves put on. First thing I'm going to do is I'm going to come in here and I'm going to remove the Tegaderm bandage. So keeping tension on here, I'm going to pull away. Good. Once I have removed that, I'm going to keep the catheter secure. I'm going to remove the tape and throw this away. Okay, I'm going to be ready with my sterile gauze right here. And then I am going to go ahead, actually, before I do this, I should have done this already. Let me get this ready. Oh, come on. Get that ready to go over the bandage. I'm going to go ahead and remove the catheter, put the gauze on, and I'm going to go ahead and inspect the catheter, make sure that the integrity of it, the full length of the catheter listed on the bandage is there, and then I'm going to dispose that in the trash. Once the bleeding has stopped and the patient feels ready, I will then get a clean, sterile gauze. Put the clean one on. Grab my tape. And place the tape over it. Remove my gloves. All of my supplies I didn't use. I will go ahead and leave, wash my hands, and document the results.